Now let's come to the other question. Analyze problems faced by the Indian health sector and discuss role of Ayushman Bharat. Focus here. The question says analyze. This is analysis. The question tag analyze is a very important question tag, and also here it should be discuss role of Ayushman Bharat. Both the question tags are important here. Here we cannot just simply mention points. Okay, what kind of we also need to provide the analysis as well. Okay, just listing down of the facts, let's say infrastructure, hospital, doctors, it is not going to help us. Okay, we have to bring up analysis in this. So let's try. This is very important question because Ayushman Bharat is in the news, and understand the essay can also be asked. That's the reason I have tried to include this thing. There is a topic of inclusive growth. They can ask here. They can ask their this thing, or else they can ask in the social justice part, or else they can ask simply directly under the heading of the health and education, which is mentioned in your economy section. So let's try to understand. Analyze problems faced by the Indian health sector and discuss role of Ayushman Bharat. Very important. I have tried to provide the content here comprehensively. See here. So what could be the context here? Problems faced by the Indian health sector and discuss the role of Ayushman Bharat. India's health system is complex and multifaceted, with both government and private facilities providing the medical services. Despite the significant progress in recent years, the health system still faces a number of challenges. In this way, it will help you for a kind of link has been established between the introduction and the body. So there should be some kind of natural flow in the answer from the introduction to the body. Okay. So now let's understand the structure of the Indian healthcare. If you have seen here, while discussing the problems, I have just not listed down. I have tried to give some kind of content, okay, so that to bring the coherence. So what is this primary healthcare? Okay, let's try to understand properly this thing. How our health sector has been actually formed. So if you observe, India has three-tier healthcare system. There is a primary healthcare system, secondary healthcare system, and the tertiary healthcare system. So primary healthcare, again this primary healthcare, it is divided into the three levels. Okay. So generally this primary healthcare is provided in the rural areas as well as the urban areas where the population is more than 50,000. Okay, there you should have the primary healthcare centers. Okay, these are provided under the concept of the National Health Mission. Okay, so under the National Health Mission, primary health centers are strengthened or provided the funds or focused. So now again this three-tier health structure, primary healthcare, secondary health, and tertiary health. Now within this primary healthcare center, there are three subdivisions. Okay, generally at the village level, if you are living in any rural area, whenever you face any kind of health issue, the first point of contact are the Asha and the Anganwadi workers. These people are the first point of contact. Okay, let's say you are facing any kind of medical health issues. Okay, these are the people, okay, who tell you, okay, what you should do. These are not doctors. These people are just 10th class pass people. Okay, they will, let's say they will give you, okay, they will help in the family planning. They will provide the oral contraceptives. They will bring the awareness about the sanitation. They will bring the awareness about the hygiene. They will also focus on the schemes that are present for the people in terms of the nutrition, especially the Anganwadi workers. Your ICDS scheme is being implemented through the Anganwadi workers. Now group of villages together will have the auxiliary midwife nurse. Okay, now she is the one who can conduct the delivery. She is above that. Okay, now at the primary healthcare center, you have doctors. Okay, now what is actually the objective behind the primary healthcare centers? Okay, some group of villages together will have the primary healthcare center. This is primary healthcare center. The actual purpose is to act as a preventive healthcare. Okay, yeah, it should be a kind of center where whatever the basic minimum level of health issues should be provided at free of cost. There should be proper diagnosis, there should be treatment, and whatever the medicines that are available, it should be freely provided to provided by the government to the people. Now all the funds that is required for this program, that is coming under the National Health Mission, under the Ministry of Health and Family Welfare. So this is the concept of the primary health care center. Let's say you have got some kind of cough. Okay, maybe because of it could be because of the TB, or else it could be because of some kind of general viral infection. So if you visit the primary health center, they will do some, if it is a small issue, they will give you some kind of diagnosis. They will do the diagnosis and they will give you the medicines which are also free of cost. Okay, let's say you are not visiting the doctor because doctors are not available. By the time you go to the doctor, your disease might have worsened. Okay, then the cost of your treatment might increase. So primary health care centers, the basic objective is to prevent from the disease burden, people from the disease burden, to reduce out-of-pocket expenditure. If these primary healthcare centers are good, okay, we will not face bigger health issues, right? So all the things should be delivered at the primary healthcare centers at the free of cost. This is the actual, but what actual is always different from the reality, right? So what is happening at the primary healthcare center? The primary healthcare centers are primarily focusing on the RMNCH plus A. This is a kind of abbreviation for the reproductive health, maternal health, neonatal health, child health, and also the adolescent health. Okay, so this is what actually only the major focus is on the women and child, simply speaking, on the primary healthcare center. For the other issues, there is no actually diagnosis is not happening, free medicines are not happening. Only for these purposes, some kind of thing is happening. Only sometimes doctors will be visited. Okay, the infrastructure is to somewhat extent present under the National Rural Health Mission only in the rural areas. The urban infrastructure is even bad. Okay, so there is no good infrastructure. Because of this thing, your primary healthcare centers are facing various problems. If this primary healthcare center is good, let's say you have some bigger issue. Let's say you are getting headaches. Okay, any small headaches, etc. They will give you some kind of treatment at the primary healthcare center by small basic level of the doctors. Or else, if it is a regular kind of delivery, here only it can take place. Let's say any kind of any kind of complications has happened. So then they will recommend you to go to the district level hospitals at the secondary healthcare. At the secondary healthcare, they are generally they are present in the block level and the district level hospitals. Okay, here there will be specialist diagnosis will happen, more number of testing, more number of diagnosis, and these things should happen. Okay, here also the district hospitals that are being provided by the government, the actual thing is to provide the free of cost. Most of the diagnosis should be provided the free of cost. The doctor should give you the proper treatment. When the problem further affects you, then you will go to the tertiary level healthcare. Okay, where there is more research is happening, where advanced level of surgical things are happening, where more specialized doctors particularly focusing, let's say, cancer treatment, or else maybe surgery has to be done. Okay, something more specific has to be done. So we have discussed what are the problems of the primary healthcare. We have seen it is majorly focused on the RMNCH plus A. Okay, then what are the issues with the secondary healthcare services? These are now those are restricted to the rural areas, but these are restricted only to the urban areas. The doctors are not present. Only these district hospitals are present in the few centers. Okay, it is not present properly in every district. It is not happening in that way. Okay, within the state also only few districts have this district hospitals, and even if they are having the district hospital, but they don't have proper ventilations, proper oxygen cylinders, and they do not have the presence of the doctor, manpower, nurse, beds, all these things are not present. Okay, if these things would have been present, the pressure over the tertiary healthcare system would be reduced. If you go visit the major hospitals like say NIMS, IMS, if you visit such kind of hospital, they are overcrowded because the things that should be happen at the primary and secondary care health is not happening. So people are flocking there, right, at the tertiary level. Okay, and they are severely overburdened. Okay, they are not able to handle meet the capacity of the people. Okay, so as a result, the government cannot meet the capacity, so the people move to the private sector. The private sector is very strongly present in the tertiary care. Okay, private sector is not present in the primary primary healthcare, but private sector is very well present in the secondary and tertiary healthcare. Now the private sector is profit motivated, so the cost of healthcare sector is very high. So since most of the services are present in the private sector only, the out of pocket expenditure, means expenditure that you do from your pocket to meet your health expenditure, that is increasing, right? We have discussed in the 1995 liberalization policy, we have discussed and how we have allowed the private sector. In this, I have also discussed how the health sector is becoming costly. This is one of the major factor where the private sector participation in the tertiary healthcare is becoming costly. But it doesn't mean private sector should not participate, right? The government does not have the capacity, so private sector is playing the role. But the problem is we have different types of the private sector hospital. So currently there is no standards. Okay, let's say you need to go, you have some kind of fracture and you have to do some surgery. If you visit one hospital, Apollo, they will charge some different cost. If you visit Kamineni, they will charge a different cost. Schemes different cost. So like this, there is no proper standardization, right? And also this is one problem with the private sector. Firstly, cost is very high, and then secondly, the standard of services they are delivering is varying. Okay, the cost is also varying. The standard of services is also varying. If you find the service is not proper, it is very difficult to find to hold the doctor accountable. Apart from this, you will also because of these reasons, since the government cannot participate in the tertiary healthcare sector because government does not have the fund, so national health policy of 2017 in the national health policy 2017, government envisages that okay, let's take the help of the private people, let's do the private participation. So government has come up with a different model where government will say government will provide whatever the funds that are there to the primary healthcare center, and secondary health and tertiary health, since already private sector is there, let's collaborate with the private sector through insurance model. Government will say okay, let's let the people take the insurance, government will provide the premium, and whatever the cost is there up to 5 lakhs, government will compensate to the people. Okay, because that's how the insurance work, right? If I am facing any kind of problem, health sector, if I am having the insurance, so there would be some kind of coverage, but for that I have to pay the premium. That premium is paid by the company. Once if I have to claim my insurance because of any health issue, then that the cost is paid by the insurance company. This is how things work. Okay, now this is what planned in the Ayushman Bharat. Now one more point, Ayushman digital mission is also there. Now what is this? Now see, let's assume I have some kind of headache issue, health issue. Let's assume that. Okay, if I want to, if I want treatment for this, I have to visit the doctor. Then doctor will ask me to go through some kind of diagnosis test. Okay, I will go through some kind of diagnosis test. Then some other doctor will ask. Then things are not working here. Then I have to visit some other doctor. Then the doctor will again ask me to go through some kind of diagnosis test. So I have to go through entire checkups again. So like this, there is no proper digital data available. If let's say if I have done my diagnosis test properly at one place and I have proper centralized record system for that, then I don't have to go through that, right? And also I'm also aware, okay, through digital data where which kind of doctor is present in which hospital, what is his experience, all this centralized digital data is available. Okay, then I can choose the doctor. Okay, and I can tell, okay, this is my medical history, this is this is the doctor availability. Then this will improve the governance of the health sector, right? So that's why government is planning to bring the digitalization in the health mission, that is called a national digital health mission. But in order to do all this, government need fund, right? So but the government contribution towards the health sector is very less. It used to be somewhere around 1.3% of the GDP. Government in the 2017 has said that, not in the 2017, from long back there is a recommendation that it should be increased to the 4% of the GDP. Okay, in the 2017 national health policy, government said we will increase it to the 2.5% of the GDP soon. Now they have come to very close, somewhere around 2.1 and 2% of the GDP, especially during the time of COVID. Okay, now we have tried to increase our medical supply, beds, these all things we are doing. Okay, so these are the different problems that are present in the health sector. Now, now with this understanding, now we can revisit the problems that are being faced by the healthcare system. I have divided the problems into the primary healthcare, secondary healthcare and tertiary healthcare. See, now the primary healthcare, inadequate quantity and quality, focus only on the rural areas. Now if you see, there is a epidemiological transition that is happening. You might have heard about the demographic transition. Demographic transition means a country moves from different types of the demography as the nature or economy or else the socio-political economic aspects changes. The demographical aspects, let's say literacy, urbanization, education, health, along with this epidemiological aspects also changes within this demographical transition only. That means as the population are moving from stage 1 to the stage 4 in the demographic transition, there is a epidemiological transition from the infectious diseases, the diseases which are communicable in nature, means like say parasite based, okay, malaria, TB, from these kind of diseases, lifestyle oriented diseases people will face when the nation becomes highly developed. This is because of the sedentary lifestyle and lack of touch with the nature, poor eating habits, and also heavy stress. So mental health problems, cardiac problems, high amount of blood pressure, diabetes problems, these are called the non-communicable diseases. India is considered as a diabetes capital. So especially in the rural areas, 60% of the rural area people are facing high amount of this non-communicable diseases. Okay, but this primary healthcare center mainly deals with the communicable diseases. Now we are also seeing the increase of the non-communicable diseases. That is becoming very hugely challenging for the India. We are yet to deal with this communicable diseases itself. Still we are fighting with malaria. Still we are fighting with this TB kind of things, Japanese encephalitis, which is present in your disease section in the science and technology, which is very important part. Okay, so now we have both the twin kind of diseases. We are facing the communicable diseases. We are also facing the non-communicable diseases. Okay, so no focus on the diagnosis and prevention, only sick care or mother and child care oriented. That's what I have discussed. RMCH+A. Non-integration of the Ayush. Ayush means not just allopathic, that is Ayurveda, Yoga, Unani, those kind of medicines. Okay, that is not properly integrated with this medicine. Presence of squawks means those are the people who do not know much about they are not professionals. Okay, some kind of doctor, okay, use this kind, okay, use this medicine, okay, you will get cured. Such kind of things are called as quacks. Okay, and also people have also lost trust. Okay, they do not want to visit the government hospital. Let's say if their son or daughter is affected by any kind of health issue, they don't want to visit the government hospital. They want to visit the primary healthcare because they don't have the trust with the people. Now that's the reason, if you have seen the union government now it is talking about the trust based governance. Why this trust based governance is important is, if there is no trust, there is a concept that was mentioned once in the economic survey, that is called the low equilibrium trap. Low equilibrium trap means people are paying less taxes to the government. Why the people are paying less taxes to the government? One of the major reason is the people are not willing to pay taxes because they feel the government is inefficient. Whatever the money they pay, that money will be corrupt or else lost, and they are not going to get such kind of good services. So people will not pay taxes, government will not provide services, and that will be trapped. So that is because of the lack of trust. So same lack of trust only, they are not going to utilize this healthcare services. They will also not pay taxes, and that will become a vicious circle. Okay. So that is also a problem. Massive shortage of the supply of human resources, hospital, doctors, which are made worse. Okay, 61% of the primary healthcare centers just have one doctor, while nearly 7% are functioning without any. So such a very problematic system. Next, secondary healthcare refers to second tier of healthcare in which patients from primary healthcare refer to the specialist in the higher hospital for treatment. In India, the health centers for secondary healthcare include district hospitals and community healthcare centers at the block level. Now, what are these? Now, those primary healthcare centers are primarily rural oriented. Now, these are primarily urban oriented. 80% is doctors, 75% is dispensaries, 60% is the hospitals in the urban areas. Now, they want to develop the PPP model for the secondary and tertiary healthcare, as I have discussed. But the private sectors are not willing to participate, okay, as per the regional requirement, okay, as per the way that brings the health to the people. That way the PPP is not happening. And also public health facilities in the district health hospitals, the doctors are not present, and we can't hold them accountability. Even if their quality and efficiency is poor, there is no proper accountability mechanisms, and whoever the doctors are present, they are overburdened because of lack of this trust only. If you have seen, you will see the people are beating doctors. Such kind of things are happening. So that's the reason during the time of COVID they have amended the act. Okay, they have made attacking the doctors a punishable offense, right? And they have also provided insurance for the doctors, not for this bidding purposes, but for the thing they are the first line warriors. Okay, so inter-region, interstate and district variations are there. Now tertiary healthcare. Tertiary healthcare, that is predominantly dominated by the private care. This is more of advanced healthcare, but it is dominant only in the urban areas by private sector. It is present only in few metro cities. So because it is dominated by the private sector, now this is what analysis is. It is asking you analyze the problems. You have to give this analysis, or else you will not get the marks. Okay, high out-of-pocket expenditure. Though out-of-pocket expenditure has come down from 64 to 48%. As I have mentioned, there is no standardization of services. Private sector is nearly 70%. Government sector is very poor. This is what. So apart from this, what are the other issues you have? So people do not have the insurance. Okay, how many of you have the health insurance? You yourself can check. Okay, the insurance penetration in India is very poor. Okay, 14% in the rural areas and 18% in the urban areas. This will increase the cost of the health, right? It is very important for the people to take the insurance. When you are young, the premium cost would be low. When you are disease free, the premium cost will be low. As your age grows, the premium cost will be high. So it is in the early time periods of your age, if you go for the insurance policy, you will get very good benefits. Okay, so that is a problem. So national health policy 2002 itself, they have spoken about the increasing the government health spending on the health to the 2 to 3%, which not it has happened. Can you see the 20 years lag? Medical education related problems are also. You might have seen about the people who are studying for the MBBS. Okay, the number of seats are very less, right? Because less number of hospitals are available, and these hospitals are also facing the regional disparities. Okay, so there is also one more problem. So in order to handle this thing, government has come up with the Ayushman Bharat. Ayushman Bharat has two major components. One thing is they are talking about the health and wellness centers. These health and wellness centers are nothing but strengthening up of your primary healthcare centers. Okay, government will invest very well. There is a declaration called Astana Declaration. UPSC has already asked the question on the Astana Declaration about the importance of the primary healthcare. So government is trying to invest more and more on the primary healthcare centers, because this is acting as a preventive first line of health. If I am treated well at the primary healthcare, if the treatment is good there, okay, it acts as a preventive measure. Okay, then the secondary healthcare will not be overburdened. Out-of-pocket expenditure will be reduced. So much of disease spread will be reduced, right? If the disease is diagnosed at the initial level itself, then the spread of disease will be reduced at the primary healthcare itself. So they want to create this health and wellness centers as a kind of comprehensive healthcare, where they can link the Ayush with your allopathic system. They will also talk about the provision of yoga services, mental health services, everything. A quality healthcare services with the provision of the diagnosis, with the provision of the medicines, everything should be available. Very good services should be available at the primary healthcare center. Okay, they will be converted to the health and wellness center. The secondary and tertiary healthcare systems will be addressed by the Pradhan Mantri Jan Arogya Yojana. This is a kind of insurance model. Okay, that's what I have already explained. That is what is mentioned here. So 5 lakh coverage per the household. There is no limit on the family. It also covers the pre-medical and post-medical charges. But what are the issues? Okay, the post-hospitalization coverage is only for the 15 days, and also there is no lack of standardization in the treatment. Even here also, while provision of the insurance services also, few hospitals are empaneled, right? If you have to claim your insurance, you have to go at particular hospital only. You cannot go at some hospital and you claim the Ayushman Bharat health insurance. There are certain empaneled hospitals. So now again there is a regional disparity, right? So that problem of regional disparity is again visible, and also there is a problem of collusion can happen between the insurance company and the hospital. Unnecessary cost will be laid on by the hospitals, and cost will be shared between the insurance company and the hospitals. Okay, so there was a criticism. Okay, Indian Medical Association says, okay, you are spending a lot of money on this private sector insurance based model. Why not spend the same model on the district healthcare? Try to strengthen our public healthcare. It will be helpful in the long term. This is what Indian Medical Association says. Okay. So capping of certain costs. Okay, government has said that certain services cannot be more than this cost, but such capping of cost is not based on some kind of standards. Okay, it is unscientifically designed. If it is done, if that way, the quality can be compromised. Okay, so these are the problems that should be addressed, and also it should be made our public healthcare system in a comprehensive manner. I hope the health sector has been covered very comprehensively. Ayushman Bharat can be asked, National Digital Health Mission can be asked, or else they can ask a role of technology in the health sector, they can ask digital technology in the health sector, they can ask. Okay, so this is the content that you have to write.